Good morning, everybody. We are presenting about hepatitis C virus infection. Hepatitis C is a major public health problem with a global prevalence rate of 2.8%, equating to over 185 million infections and more than 350,000 deaths annually, and 3 million to 4 million new cases of HCV infection emerge every year. It is also projected that hepatitis C will be the highest hepatitis related mortality in the future. Now, hepatitis C is a liver infection caused by hepatitis C virus or HCV. Hepatitis C is spread through contact with blood from an infected person through blood transfusion, as unsafe needle injection, sexual intercourse, and others. The complications are preliminary asymptomatic, mild, or severe, with spontaneously clear or slowly progress to chronic liver diseases, cirrhosis, and finally hepatocellular carcinoma or HCC within about 20 years. It is also related to extrahepatic complications after long-term infection, such as glomerulonephritis and others. Now, let's talk more about HCV. There are 7 major genotypes and over 67 subtypes of HCV, which varies by the route and of transmission and geographical location, as you can see in the map. The genotypes 1, 2, and 3 show a widespread distribution in almost all parts of the world. HCV genotype 4 has been traditionally restricted to few countries in the Middle East and Africa and is more prevalent in Saudi Arabia, Bahrain, Jordan, Egypt, and Ethiopia. HCV genotype 5, 6, and 7 has been reported in South Africa, Southeast Asia, and Central Africa, respectively. Genotype 1 is more prevalent among patients with history of blood and blood products transfusion, surgery, and dental procedures. Infection with HCV genotype 2 is mainly associated with nosocomial transmission and prior dental treatments. Genotype 3, on the other hand, is frequently found in intravenous drug user communities and in those with history of tattooing and piercing. It is also associated with a more rapid progression of fibrosis, a higher degree of osteosis, and a higher incidence of cirrhosis and hepatocellular carcinoma. Genotype 4 is mainly transmitted through high-risk sexual practices, especially among homosexual males and intravenous drug users. There are current management of HCV infections, which are the following. The first is the interferon-based therapy, which is a natural cellular protein which inhibits HCV replication. It also has immunomodularity effect that enhances the host-specific antiviral immune response and may accelerate the death of infected cells. Second is the direct acting antivirals or DAAs. This has been developed which specifically inhibit the function of viral proteins that are essential for viral replication. However, even more advantageous than IFN-based therapies, it is linked to resistance-associated mutation, leading to resistance-associated variants, thus treatment failure. HCV diagnostics. Anti-HCV antibodies are detected by using serological screening tests. Detection of anti-HCV antibodies indicates current or past HCV infection. An additional test called HCV RNA test or reverse tricryptase polymerase chain reaction assay or RT-PCR is needed to determine if a person is currently infected with HCV. However, those infected individuals with undetectable levels of HCV RNA in serum and plasma remain undiagnosed. This is called occult HCV infection, which might be a menace in blood transfusion. Prophylactic vaccines. Several vaccine candidates against HCV has been developed so far, but has not been approved yet for human use.